Operation Walk is a private, not-for-profit volunteer medical services organization that provides free surgical treatment in developing countries for patients who have no access to life-improving care for arthritis or other painful and debilitating bone and joint conditions. In 2006, Dr. Cecil Rohrbeck and Dr. Bob Bourne assembled the first international team of Operation Walk volunteers and flew to Antigua, Guatemala to perform hip and knee replacements for a population with virtually no access to procedures that are taken for granted throughout North America. Based on the desire to make a significant difference and lasting impact, Operation Walk has made a commitment to the people of Guatemala to return each year to Hermano Pedro Hospital so that the exponential benefits of these surgeries can be realized by a focused group and that their effects can be both enduring and measurable. Operation Walk is funded entirely by donations, with every dollar received directed to its missions. It has been possible for the team to return to Guatemala each November since 2006 because of the outstanding support from sponsors and volunteers. Smith & Nephew has donated all implants, and other corporate and individual donors have made it possible to fund infrastructure upgrades, such as the installation of air conditioning and patient monitors for hospital ORs. Operation Walk also fosters improvement of the host country's healthcare system by teaching and sharing knowledge with in-country medical professionals. Operation Walk operates by responding to invitations from in-country physicians. They build teams of volunteer healthcare professionals who are experts in their field. In the spring of 2010, Operation Walk was asked to assist with the treatment of a population of patients in Ecuador with a serious condition known as acetabular dysplasia. It results from untreated hip dislocations, prevalent in the country due to the age-old practice of swaddling children at a young age. In countries like Guatemala and Ecuador, very few people have the luxury of transportation. That reality, coupled with a high manual labor-driven society, means that the need for mobility is critical for subsistence. Without a public health system that supports such treatments, and with procedure costs well in excess of average annual salaries, many thousands of people are left to suffer without relief or hope. In the year prior to a mission, Operation Walk works with sponsors and supporters to secure all the necessary equipment, soft goods, and medicines needed for the upcoming mission. An all-volunteer team of more than 40 medical professionals from Canada, the United States, United Kingdom, and Spain is assembled with specialties based on the target condition to be treated. One team recalls how the conditions in Guatemala are worlds apart from the level of need and care that is taken for granted back home. Upon arrival, they were faced with wards full of infants with severe conditions. Children lined the hallways in the permanent care of hospital staff, and hundreds of people came to the hospital every day at 6 in the morning for the chance to see a doctor. With just a few days to perform operations, the first task is always to decide who they'll be able to help. Some people travel for as long as 14 hours in the hope of receiving these life-changing procedures. Families wait anxiously for their name to be called, their chance.
Unfortunately, was a gunshot victim about 5 years ago, fractured his left femur up at his hip joint, and had a surgical procedure done to stabilize the fracture, but there were some technical challenges that they ran into at the time of the surgery. So he basically developed severe arthritis of his hip. There were bullet fragments within his hip joint. Removed the rod that had been placed in his femur, removed the bullet fragments from his hip joint, and then we went ahead and did a hip replacement for him.
He's very, very happy. Like, he can't tell how happy he is, because from about 2 years he haven't been able to not even sit or to walk, and the pain was too too much, and that now he can believe how easy it is for him to be able to sit.
And this young farmer, Carlos, was unable to walk or work to provide for his family after a severe tractor accident went untreated. Operation Walk gave Carlos a new knee and the potential for a vital future. The impact from these medical missions is profound. Operation Walk may perform as many as 70 joint replacements in a 6-day mission in Guatemala, a figure that represents a third of the total such procedures done in the entire country in a single year. On one of the missions, while their parents were changing lives in the operating rooms, the youth volunteered throughout the week, helping with infants awaiting cleft palate surgery and supporting activities for residents in permanent care at the hospital. The spirit of giving that starts with the support of donors back home makes a profound difference in so many ways. Operation Walk deeply appreciates the generous support of sponsors and volunteers who make it possible to provide life-changing procedures, making a difference one step at a time.